Let's continue our event. Just one reminder that those of you who are not registered and put your signature on registration, please do that. Or if some colleagues will come a little bit later, then please remind them, yeah? But now the floor is for panel. Thank you.
Yeah, thank you. Thank you very much. Oops, this is very loud. Need to try to adjust this. So as you see, well, first of all, welcome back from lunch, also from my side. I'm really happy to be here in Riga. It's my first time in the Baltics, and I'm stunned by the beauty. I heard that Riga is a beautiful city, and the Baltics in general are beautiful. And it's very similar to Rostock, where I also spent quite a few years at the MPI. So thanks for joining us again, and thanks especially also to the panel. We have a very high-level senior panel here. I'm gonna say a couple of words to each of the panelists in a moment. My name is Harald Wilkoszewski. I'm the head of the Information Center of Population Europe, and this event is also nice for our team because the Information Center is in Brussels. We just started that activity in January. The Secretariat is in Berlin, so it's nice to meet the team every now and then in various spots, and now we're in Riga, so that's nice. I think the topic we're talking about today, and it was mentioned already multiple times, is actually at the forefront of the policy discussion in Europe and also national administrations. And it's not only because the WHO has decided that we shouldn't eat sausages anymore, and I think we'll come to that topic actually later, because that touches actually upon a very important question, how to talk with whom we talk about, the people, and how we engage them in healthy lifestyles. But it is at the core of modern policy making in times of aging, in times of low fertility. How can we reach the full potential in our populations, and health is at the core. And Lulin, thank you again. I mentioned that just a couple of minutes ago, because we had a little mingling by email prior to this event, but your resume was amazing, so thanks a lot. And there was a lot of overlap between the questions we thought about and what you said. We will not touch upon everything, we just have an hour, but there will be a lot of interesting things to talk about. Now let me talk quickly about the panelists we have here. And thanks to you for coming. You all have busy schedules and had to travel partly. I will start on the left, and that is Geerts Brigis, and he's the head of the Department of Public Health and Epidemiology at Riga Stradiņas University. I will not say much more, just to save a bit of time. You have all the CVs in your conference pack. To the left of Mr. Brigis, there's Mrs. Evie Normet, and Evie Normet is Deputy Secretary General for Health at the Ministry of Social Research in Tallinn, Estonia. So we have Latvia, we have Estonia. Our next panelist is actually, we're very glad that she's here, because she brings in the European perspective, which is very important. Also, we talked a bit about policy changes in the countries and how they can collaborate and how they can learn from each other, and the EU can be instrumental in that. So we hope we get some insights on that from Mrs. Inna Steinbuka, and she's the head of the representation of the European Commission in Latvia. And then last but not least, I have to take the other sheet again, sorry. It's Mr. Aurelius Riga. He's the president of the Lithuanian National Tobacco and Alcohol Control Coalition and head of the Health Research Institute at the Lithuanian University of Health in Kaunas. And that sounds actually quite an intimidating title, I have to say, the Control Coalition for Alcohol and Tobacco Consumption. I'm not a smoker, but a glass of wine is nice every now and then. I think we will talk also about lifestyle in that sense and what it means for individual health, but also for population health. So I'm really excited that we have this diverse panel here. We have all three Baltic states represented. We have the ministry perspective, the governmental perspective. We have the research perspective. We have the EU perspective. And we have an important governmental body, NGO, represented. So this promises to be a very interesting discussion. So that you know what the rules of this panel debate are, because this is not just a service. We also want you engaged in this discussion and want your questions and your feedback. We will start with an introduction round so that we hear each of the panelists. That will be very short. Each of the panelists will have about 2 to 3 minutes. And after that 10 minutes or so, we will go into the discussion. And after we warmed up a bit, it's a bit like sports, we need to warm up a bit. And once we're warmed up, we will open the floor so that you can also spontaneously ask questions, because we think that would be beneficial. We just have an hour, and it's better to have that integrated and not a block at the end. Okay, so if there are no questions from your side, and from your side, I think we're ready to go. And as discussed with you, first question is not a surprise. We would like to know from your specific background, so where you come from, your country, your profession, your institution. What is the most urgent issue when we look at health and mortality trends in the Baltics? And let me start with Aurelius.
Okay, thank you for such a nice presentation of us, and it's really a pleasure to be with all of you and to listen all of your presentations that really enlightening and giving the broader perspective. But still coming from one of the Baltic states that was few times mentioned as being in a very bad situation according to health inequalities and lifestyles. And being a researcher and medical doctor, I'm a psychiatrist too, not just an NGO and researcher. For a few years I was looking also to the statistics and I was trying to find out what actually is happening with a country like Lithuania, but Latvia and Estonia, they are quite in a similar shape. And we have two very big I would say public health problems that is interrelated with health inequalities. This is very high alcohol consumption and very high suicide rate, which is again among the highest in not only in the Europe but also in the world. And I was trying to find out why it is so, why Lithuanians are not so happy to live, and why we are drinking so much. And some people say that it's because we have too much stress, or we were damaged by the Soviets during the Soviet time. We were traumatized. But it doesn't really explain everything, because I wouldn't say that the Latvians or Estonians were not traumatized. Or if you would take Israel, the people, the Jewish people that were almost the biggest part of them were killed during the Second World War, and they still don't drink as we. And they don't commit suicide as we. And we looked to the correlations of the life expectancy and different kind of diseases, and the clearest association is exactly alcohol consumption, the very, very high alcohol consumption. And what we found also, that if the state is doing something, actually the Gorbachev's period that was demonstrated in many slides from different presenters have shown this effect, especially in this part of the world. And I was reading his interview in one of the newspapers, and he called this anti-alcohol period as a big mistake done by him and other politicians. And I was wondering what that means. What kind of mistake it was. And this mistake led to destruction of the Soviet Union. People became sober and they became more interested into political things and probably healthier lifestyle. So I would say, from my perspective, this is one of the most important. And really changeable things.
Okay, thank you very much for this introduction. We go on to Ina.
Well, hello to everybody. It's my pleasure to be able to address this very sensitive topic. I has been asked to provide you the perspective of the European Commission. I can tell you that I spent 6 years in Eurostat, and one of my positions was Director of Social Statistics, including demography and including health and the other branches. Therefore, I'm familiar with figures and with comparative image of demographic situation in Europe. And I must say that unfortunately, now I'm already 4 years in Latvia, and this bad statistical image of 3 Baltic states has not improved at all, and maybe even is worsening. So these demographic challenges in the Baltic countries, I'm sure you have discussed it in the first part of the day, they have significant social and economic consequences. Maybe I can ask you to show my first slide. I have only 2 slides, don't worry, and they are very easy to understand. So first, I would like to emphasize the accessibility of healthcare. Or maybe it's not accessibility, but non-accessibility. On this slide, it's very sunny.
And I'm sorry.
Sorry. Okay.
The weather is too nice here,
okay,
so
I'm
we
sorry.
can't see it.
I will try to describe it. On this slide, there is an image of self-reported unmet needs for medical examination, structured by different reasons. So why people cannot go to doctor, why they cannot make analysis and so on. And there are, 2 old member states of the European Union, including Latvia, Estonia, and Lithuania. As far as Latvia is concerned, the majority of people said it's too expensive. So very expensive. So this is the main reason. Too far to travel a little bit, waiting list a little bit, there are also other reasons, but still the most important one, too expensive. And there is quite a big difference with Estonia and Lithuania, because as far as Estonia is concerned, the survey suggests that the main reason for unmet need for medical examination is a long waiting list. As far as financing is concerned, it's not a big deal, at least concerning to this survey. And very similar picture is in Lithuania. However, from the first glance, I mean, total unmet needs in Lithuania are much lower as compared with the neighboring countries. So sorry for this description. It's better to see once than to listen to me, but sun is actually a very nice thing, so we will look at these things in a positive way. Now, again, so very important is to improve accessibility of healthcare, in particularly in Latvia. Now, second thing which I would like to address, this is actually why this difference is in these 3 Baltic states. Why in Latvia is too expensive as compared with the other Baltic states. In our opinion, very essential impact on the differences in healthcare of the Baltic countries has been exerted by the decisions regarding the financing and governance of the health system. And now I would like to mention this compulsory healthcare insurance, which is available in Lithuania and Estonia, and which is not available for Latvia. And I must say that in Latvia there are permanent discussion about possibility to implement this compulsory healthcare insurance scheme, but unfortunately there are debates and debates and debates, but no political implementation so far. As the third thing which I would like to draw your attention to, this is underfinancing of healthcare sector actually in all Baltic states. I very much understand that after a very severe economic crisis, which had negative impact on all three Baltic states, it was necessarily to maintain fiscal discipline, and I mean, budget is as it is, and expenditure are limited, including for healthcare. However, and again, the Latvian figures are the lowest one, because if we can see at this year, 2015, okay, we do not have the final budget, but this is assessment. In Estonia is 5.3% against GDP, in Lithuania 4%, in Latvia 3.6%. So again, under-financing in all three, but in Latvia the situation is worse. And the last thing which I would like to underline in my introductory remark, today I have participated in the meeting of Vice President of the Commission, Dombrovskis, with foreign investors. And you can tell me, and so what? And foreign investor presented us the survey about the investment climate in Latvia. And there is one index which they call Sentiment Index 2015. And this is assessment by a foreign investor of Latvian competitiveness by different components. And I must say the worst one of number of components is the demography. This is the first one. And the second one is quality of health and social security. You see, and this is economic consequences. So actually, the Foreign Investor Council in Latvia has addressed not only Vice President Dombrovskis, but recently has addressed a state president and prime minister about this very difficult situation. So this is for the beginning. Thank you.
Now it works, I think. It's a bit tricky, there's a little lag here. Thanks, Anna. So maybe to quickly collect what we have, because you gave us 3 points actually, it's very interesting. So Aurelius started off saying alcohol is the biggest problem, so an individual factor, and he also said that policies can change and can have a huge impact and even can lead to system change, and if that was desired in the case of the USSR, that's another topic. And then Inna said, look, we need to talk about accessibility and access to healthcare. And then there's variations among those countries, because some are more struggling with finance, others with waiting times and so on with costs. So, but as a main topic, accessibility for the people. And then also you brought up the comparative perspective between the countries and within the EU, and that we are actually in a sort of competition also for talents, for performance, and in essence it's about economic prosperity and sustainability. So that were the first 2 sort of statements, and now let's move on to Evie, please.
Thank you. As it is quite a difficult task to highlight the main or the biggest problem in all 3 Baltic countries due to population health, I just start with describing the health policy process in my own country, in Estonia. And as all countries' health policy objective is the extension of human life, in particular the increase in the number of healthy life years through reduction of premature mortality and morbidity rates, and provision of high-quality medical and nursing assistance, as this is in Estonia the main goal. And we know where are the problems. A significant part of health loss is preventable. The 3 main causes of premature death are diseases: cardiovascular disease, cancer, and little different from whole Europe. In Baltic countries, on the 3rd place are injuries. And if I answered directly to question, then I think it is one common problem which we already have solved partly, but it's still one of our health policy priority. And as we all know, all three can be significantly affected by environmental factors and health behaviors. And as we all know, the main health risks now are alcohol, tobacco, and so-called rising star is overweight and obesity, unfortunately. And in Estonia, already years ago, we started in 2006, I may say, we little restructured our health policy process, and we described exactly what we want to receive during long-term period. We defined indicators which we follow and measure every year or during a period, and also we agreed that we can't deal and invest only in our priorities and these problems which are important today, but we decided that if we want really reach to goals we agreed years ago, we have to deal with 5 thematic fields, and these are increasing of social cohesion and equal opportunities, ensuring healthy and safe development for children, shaping an environment supporting health, and the facilitation of healthy lifestyle, and of course ensuring the sustainability of healthcare. Thank you.
Thank you, Evie. 2 points I think you highlighted was the question of prevention, and that's I think a super important topic. And the second one is how do you address policies? And you highlighted a long-term strategy. I think something we can talk about in the follow-up. But now it gets.
Thank you. Before, certainly the main topic for today is life expectancy, mortality, and as I am a representative of public health, certainly I'm going to say something about determinants which are influencing both life expectancy and mortality. But before, certainly today this is under the big topic demography. And I have a temptation to tell you a case story. Some days ago, one Latvian journalist, his name is Ozoliņš, published in our newspapers, mass media, story about what is happening with Latvian demography today. And he got the data, the message from American study about Europe. Americans studied what is going to happen with Europe in next 20, 30 years. And he just picked out and pointed out just one point regarding Latvia, what Americans are believing, what will happen in Latvia. And conclusion is, in next 20 years, Latvia as a nation we know today will disappear. And why? What is the reason of that? Answer is demographics. Because Americans have analyzed what is happening with demographic situation in Latvia, and there is one simple conclusion, answer. This is depopulation. Because already for last 20 years, birth rate certainly is low, death rate much higher, negative natural growth, and it is continuing already for 20 years. In addition that, after joining the European Union, and especially during the economic crisis in 1989-8, when started, certainly additional factor is mass emigration. And there are some calculations that could be about 15–20% of population has left Latvia for social and economic reasons. And they are not just average inhabitant of Latvia, they are people of reproductive age. And it means that these things as population, size of population, age structure, they are influencing the situation very much. It means if now we are today talking, let's say, about mortality and analyzing life expectancy, we have to be very, very cautious and take into account what is happening with denominators, what is happening with population, what is the age structure of population. Actually, even we don't have a very good answers. We don't have enough data about this immigration. They are only expectations, calculations, what could be actually. But certainly this is first conclusion. If we're doing conclusions, then we have to pay much more attention to data, to denominators, what is happening today. Next is about period effects. Certainly, if again we're looking over the time, then we have some specific points in time which very much influenced our demographic situation. And again, if we're analyzing data like as a linear trend over the time, certainly it would be a little bit dangerous actually to not to notice. And today we already during report had a discussion about these time periods. Certainly, for instance, crisis, I mentioned already, this has a very big impact. And finally, coming back to the health determinants I mentioned and which are influencing most, actually very simple. Two main things, which is one of them is health behavior, certainly, and already a colleague mentioned about alcohol and mental health and suicides. I can add also environmental things. I can add also smoking patterns to that, smoking prevalence and physical activity and nutrition certainly also is very important in that. And the other one also mentioned by Ms. Steinbucker, this is healthcare. And at least for Latvia, probably the biggest problem is access to healthcare. The estimation is about 10% of Latvians have no access to healthcare at all, and other 10 have a very limited access because of financial reasons. Certainly, this is influencing demographic situation and mortality as well.
Thank you very much, Geert. Now, you put it in the wider context of demographics, and I hope Latvia is not going to die out, because I really like this country. But, you focused it in the end, and we see some overlap already between the priorities being set. But having looked at the time, let's dig in now. And I would like to discuss two areas with you. One is, that came up almost with all of you, is the one of a strategic policy approach there. And Evie, you gave us an example from Estonia that you actually went beyond the usual policy cycle of a couple of years until the next elections and put like benchmarks in terms of what you want to reach overall. So this kind of strategy, I don't know, to my knowledge, this is, I don't know how it worked out in Estonia, but what are the pitfalls of this strategy? Is this happening in the other countries as well? You mentioned the meeting with the vice president in our, so how can we tackle something like that? Who wants to start? Ina?
Well, let me start again from European perspectives. I must say that the European Commission and European Council is very closely following the reforms and strategies of national reforms in all member states. And in the context of the so-called European semesters, or very structured dialogue with the member states, European Commission is first trying to assess the situation, and second, come up with a recommendation, so-called country-specific recommendation. Once a year, Commission is publishing and European Council approve this recommendation, which at national grounds, generally speaking, should be taken into account when drafting strategies, national policies. With this introduction, I must stress that this year, the European Commission for the first time recommended Latvia to take action to improve accessibility, cost effectiveness and quality of the healthcare system. So this is a very important step because for the first time, European Commission put the finger exactly at this very problem in Latvia. To improve accessibility, I think it's clear why, because I have already talked about cost effectiveness. With underfinancing and quite low healthcare expensive as compared with the GDP, as a share of GDP, one should think not only about increasing the expenses, but also about effectiveness of spending. Including also preventing corruption in the sector, lowering or fighting against out-of-pocket payments and things like that. As to Lithuania, European Commission also included in the recommendation healthcare, and in Lithuania it refers to improving the performance of the healthcare system, including public procurement in healthcare sector and so on. As to Estonia, European Commission doesn't recommend anything, so it's up to national authorities to draft strategies. But this is a very specific signal to the other Baltic country and to the Estonia that the situation in your healthcare system much better. So this is.
I think, Inna, thank you very much, you were the right person to kick this off, because as far as I understand, country-specific recommendations come after a certain process. So you monitor as the EU, and you look what's happening in the country. And as we just had it on the panel, Evie was giving an example of the strategy in Estonia, and so there seemed to be actually an evident information flow. Now, why is nothing happening in Lithuania, Aurelius? Why is there no strategic approach to that?
Well, probably every country has a kind of strategy. At least politicians, they do have something like that. But I would like to take a bit broader perspective and again, looking to the data and your references that previous speakers gave, talking about the health inequalities and life expectancy, the tobacco reduction, the smoking reduction was named a few times, and it's not by accident. We do have international agreements that countries have to follow, like Framework Convention for Tobacco Control. Well, in comparison, alcohol control strategy, even at the European level, there is no such normal thing that countries could follow. And I would say that I don't know how in other countries, but in Lithuania we are very good in writing strategies. We are even getting, awards from the WHO because we write such a good strategies. The problem is strategies are not implemented. This is the biggest challenge, how to do it. And I would say that yes, we are 3 medical doctors sitting here, and from our perspective, we think that the health system is mainly responsible for health inequalities and the biggest problems in the system. But it is not, because just imagine if the health expenditures will grow up. This will improve people's health just by a little bit, because we will extend people's life expectancy. They will live longer because we have better medications. And now the health system is already starving because of lacking resources. There are new and new technologies coming. They are more and more expensive. The medications are more and more expensive, and we have to talk about things that would increase healthy living period of human beings, and we have to keep people healthy while they are becoming older and older, because the system will not survive. It's already facing the big challenges. We're lacking doctors, lacking resources, and we have to think in a bit other way, and this is not the health system problem. It's usually we can, talk between each other, and we don't need to convince ourselves that there are risk factors. But when you go to the meetings where the ministers of finances are sitting, ministers of economy are sitting, they are still talking about the GDP, that we have to stimulate whatever, vodka production, cigarettes production, because it will create working places and we will get more revenue to the budget, and so on and so on. That's where it stops finally. And finally we are told that, yes, you are doctors, do your job. You have just to treat the patients. Don't go to the changes.
Thank you, Gilius. You're moving the discussion slowly into the second part I wanted to discuss with you. Gritz, I saw you. And that is what else? What is the second unknown? And that is the individual. And how can we make people change their behaviors? But first of all, I would like to stick a bit with the system question and with Gritz.
Yes, thank you. And what I like to a little bit argue with my colleagues, and this would be more interesting. First of all, regarding the Commission recommendations to states, including Baltic states, but it's certainly, this is a general European Union approach that health is a responsibility of member states. So certainly European Commission can recommend us to pay attention to different kind of things, but anyway, it's up to us to decide what will be the most important, what we are going to do. And again, here I completely agree with my Lithuanian colleague. Latvia also has a big pile of different documents, strategic documents, policy documents, and if a person from outside is reading them, it looks nice, certainly. A good perspective, understanding of problems and where we are moving. But next, if we're going to implementation, certainly, and first question in that implementation is coverage by resources. Then certainly always there is no resources for that. Coming back to the proportion regarding what is important, environment, lifestyle, or certainly could be also health care. Certainly both should be taken into account regarding the health care. For instance, Latvia totally from GDP is spending more than 6% of GDP for health. But out of that 6%, only half of this is coming from the public resources. The other half is out-of-pocket payments. And it means immediately, if there are such a big out-of-pocket payments, then this is influencing equity regarding the access to healthcare. And it means immediately there is a huge proportion of people who is out of the healthcare. And certainly we cannot neglect it. For instance, a good statistical, recently analyzed what is happening in comparison in cardiovascular mortality and also more specifically in cerebrovascular mortality, it means due to strokes in Baltic states, and I found that Estonia is again pioneers. They're doing very well. They decreased very much these cerebrovascular mortality, and looking for answers, what could be, certainly I don't have a very good answer. One is healthcare. Access to the acute treatment, it means nowadays we have acute centers for treatment of strokes, and there is very essential during the first 3-4 hours to bring patient to the hospital and start thrombolysis, specific treatment, and this is very much improving survival and decreasing mortality. And certainly if there are no resources, no access to this, both because of lack of financial means, also lack of infrastructure for that, certainly this is influencing these mortality trends.
Microphone. Thank you, Gert. I'm grateful that you gave a concrete example of what works to reduce mortality and what is an important factor. And you were talking about acute medical care. But then again, we've already talked a bit about prevention. There's a curative sector, and there's also rehabilitation if you look at older ages. And as far as I know, in most of the countries, the curative system is the strongest system, and acute care probably falls into that pillar as well. Evie, Estonia seems to, you didn't get any recommendations from the EU, so at least the EU is happy with you. So how did you implement these goals? So where are you in the road to implement those long-term goals? Because we heard from Aurelius and also from Geertz, there are strategies lying around, but they're not materializing. How did you manage?
Before I will very shortly introduce our policy-making process, I just want to add that we have a lot of problems in our healthcare system, but we have shortage of manpower and lack of budget and so on. But I want to put on the table one new thing, and it is a problem that we can't so quickly and so well respond to increasing population expectations for healthcare. And it's very tricky thing, because it seems that this expectation is not that the quality, it is something wrong with quality of healthcare services or our hospitals and other buildings are not nice, but it's an expectation that healthcare workers have to be nice and kind, and it's expectation for communication skills of healthcare workers, and it's quite new, how to say, attitude from patient side, and it requires really new skills from our side and new policies, how to manage these expectations, but we have a lot of problems from this side. But if we are talking what we exactly are doing to implement all these activities, we know the problems, but how to solve. And now I want to highlight this experience, what we have, this the collaboration with other ministers, because we can't all health risks influence from our ministry's side. And we need help from other ministries, of course from Ministry of Finance, but Ministry of Environment has much more influence for risk factors and to change the level of risk factors if we are talking drinking water or what else. And I think it's something we try to reach and more collaborate with other colleagues from other sectors.
Thank you, Evie. By the way, the floor is open now, so if you want to chip in with a question, please raise your hand and you will get a microphone. I would like to move slowly now to that second dimension that is important, and that is the individual. We can have all these interesting strategies and concepts. Evie, you were talking about what people actually want from a healthcare system. Certainly access and not too high costs, but also being accepted as a human, communication, being treated kindly and so on. But Aurelius, from your from your perspective, because you're dealing with the hard factors, alcohol and tobacco, and it's been, I think it's amazing. We know all how damaging it is, and when the WHO just recently published this sausage thing and red meat thing, again I was reminded it's, I think, 2,500% higher, risk of developing cancer than if you don't smoke. So this is an amazing trigger. Why don't we reach people with that?
Well, again, this is a simple and complicated question, and we were listening today that there are huge inequalities, taking those risk factors into account according to the education and even income level. But it doesn't explain probably the reason, because it's usually not the reasonal association, it's the correlational association. And I would give you an example. If you would give to the uneducated poor people a lot of money, they will not improve health, they will drink more. This is what we observed when it happened in Lithuania. And why we usually don't succeed to change those risk factors. This is usually the question, who is the first, chicken or egg? Where we have to start. And usually people say, well, we have to educate people, they have to be employed, they have to have enough money, and then they will improve. Some yes, but not necessarily all of them. And now we are in this vicious circle when we do have problem. Now we have another problem that is created by those problematic and risky behavior. We have children born with the problems, like fetal alcohol spectrum disorder, like smoking-related problems. They are becoming a huge problem for the system. So we have to break the circle somewhere, which is very painful for the community. And I can understand, we as a people, we all are people. Doesn't matter if we are doctors or teachers, we do behave sometimes in a bad way. We smoke or drink or eat not the right food, we don't exercise enough. And if the state intervenes, starts to push doing something in a right way, you are getting a huge opposition, because people don't want to leave their comfort zone. They want to do the things they used to do every day. And for the politicians, this is one of the biggest challenge, because we know how the politics works. Politicians want to be loved by the people, but not to hate it.
But I guess politicians also are looking at the budget in these days, and we all know how much it costs the healthcare system. So let's thanks for your input here. Let's stick there a bit, because I'm sure you alluded to a couple of strategies. How can you reach people? And it probably matches what Evie said about bringing in like moderators and trying to reach out to people. But Gets, do you know of any country in the EU you would say is doing mostly everything right? Good healthcare indicators, not too much smoking, not too high alcohol consumption. Is there any leader in the EU where we could learn something from? Any country you would say we should look there? And then maybe some clues what they do differently, better?
Certainly, yes. Countries are very different, and some countries are doing better in one field, the other field. Some countries are more paying attention to health promotion and supportive environments. The others are more stressing on medical care but what is important to stress that still in Europe today, currently, there is a trend that environmental support, the health behavior, the health promotion is on important shelf, and now every one of us understand. As an example, Latvia currently is paying very much attention, and just European Union is supporting very much For instance, there is a plan for Latvia for 2 million population during next 7 years to spend 54 million euros just for health promotion and increase health behavior towards a better health. And now we're currently at the stage how just to look which countries are the best example where we can take. Always traditionally we're very much looking on Finland, which is doing very well in this area, and how they are managing and organizing the things, and we're trying to learn. And there are certainly different other countries where also we can. Can you
give us some secrets? Have you found something where you're saying, okay, we're going to do this. This is a policy we're going to do, and we're going to take the 55 million we're getting.
Yep.
Is there an example, like any action you can tell us already now? I understand it's still in the making, but.
Yeah, but I would like also to add, in a way, how to achieve these results. Certainly, it's not a one-day step or one-year step. Well, we have to change. Nowadays, we like to talk about health literacy, and certainly health literacy takes time. And we like to use the word empowerment and different other specific terms, which are change. Actually, these are change how people not only behave, how they think, what they value, how do they understand, but certainly it takes time.
Thank you, Gert. Aurelius, you wanted to say something immediately to that?
Just a little comment, because when we talk about, again, health promotion, we usually think that we have a lot of money to do it. Well, in fact, there are policy measures that doesn't need money, it generates money. Like tobacco and alcohol excise taxes, if you raise it to the level that people will reduce consumption, you will save money in the health system, you will increase budget revenue, and you will increase the healthier life expectancy. So there are many examples coming on food taxation, like from Denmark, there was an example. On tobacco and alcohol, we have many countries in Europe with a huge variety of the taxation, starting from Scotland, UK, and Norway. And if to take the best example, what would I take? Looking to the especially children statistics and health statistics, I would say that Iceland could be a very nice example of the state doing the policy in a very consistent, evidence-based way.
What should be the relation between, you were talking about taxation. Taxation is not exactly promotion, because taxation is actually a penalty. And then we have the social question in there already. And so what is like, I mean, we're talking about freedom, self-determination of people, acceptance through that. What should be the balance there?
Sure, the taxation was originally created not to promote better health, but to create to collect budget revenue, and it was seen as a penalty. But at the same time, what we see when we talk about the health inequalities, poorest people are spending the biggest proportion of their income to unhealthy living, alcohol, tobacco, unhealthy food. So there is a point that you can reach that will change the behavior. So finally, people will switch to some other things because they will start to buy healthier foods. So generally speaking, state has to act in a way to make unhealthy living too expensive and healthy living, more and more cheap, to give more possibilities to change to something, because otherwise people really will treat it as you say, as a penalty or.
Mm-hmm. Thank you. So you made an argument now, an economic argument, so that people actually have a choice and say, okay, I'm not even not only getting healthier, I'm also spending less money on that, and that's certainly a factor. Now, I wonder, because this is what you mentioned there, with sort of a new policy style, not trying to get the individual on board as a sparings partner is actually quite fashionable throughout the EU. If you look into the field of education, if you look how teachers and students in some systems, Norway for example, are being brought to the table to determine their contents, the way they learn, the strategies. This sounds as like a similar concept. So who would be a sparings partner in that to reach people? Which societal actor Lule was mentioning that we should think about the society as well as a whole and aim for a change there. Which actors, which stakeholders in society can help us there? Ina.
Well, it seems to me that somebody told in the panel that European Commission, for instance, is not in charge of the national policy. It can recommend, right? But the implementation of reform, it's up to the national government. This is true. On the other hand, you know, this recommendation, it's not just a piece of paper which can be put under the table, because this is the permanent process of talks between not only national governments and the European Commission, but also stakeholders. Now I'm coming to the stakeholders, because the dialogue with the stakeholders also has been maintained during this fiscal year or during this European semester. And all concerns of the stakeholders have been brought to the attention of the Commission and to the national governments. The problem is, of course, to what extent it make a real impact on the final policy of the national government. Well, as to Latvia, as far as Latvia is concerned, I can only tell you that I was observing the budget process when almost all sectors of budgetary spending experience haircut, then healthcare was not the case. So there was even slight increase in the budget spending. Well, the next question is to what extent this supplementary spending will be cost efficient. What is the final goal? But I mean, what is very important is that all NGOs and sector association in health and just public at large, I think that they should really continue to put some pressure on the government and to provide messages, because otherwise it doesn't work. This is the real dialogue, citizens' dialogue with the stakeholders, which in the end should bring to the result.
Thank you, Ina. Anyone, because I looked at the clock and we are actually approaching the end of the panel already. Aurelius, did you have any thoughts on this, and Evie and Gets on the stakeholders?
Yeah, I can talk for an hour.
You have a minute.
So there are different levels, and states can approach the European Commission and ask for something. That's what exactly they would have to do if they want, like, for example, alcohol strategy or food strategy or whatever, because the Commission itself or the EU, it's nothing like God sitting on the sky. It consists from the states. So the states can make this pressure. And if to go to the national level, we have to start to think outside this box, looking to the health system. I would say it again and again, the health system cannot solve those problems. It's not capable. We have to think how to involve to the table the ministers of finances, ministers of economy, to talk with them and to present those things. And I don't think those people are stupid. They just don't know usually those arguments we are talking here about. And society has to be prepared also, because if we talk about the changes, if it happens just, you know, one day somebody is proposing something that people cannot accept, the changes will not happen because people will refuse to do it. It has to be prepared. So the system itself has to prepare people for the changes. So, and the last thing what I want to say, still, some people don't learn from the history. We still take as a stakeholders industry, which is not part of the solution. This is a usually source of the problem. In the food industry, it could be part of the solution, but when we talk about tobacco and alcohol, they cannot change the product. So that's why we are not moving forward, and we are still looking for them to tell how to do the things.
I think we're reaching a very interesting point there, and I see you probably talked from your own perspective. Tobacco and alcohol, we know these are strong industries creating huge revenues. But Evie, you had a reaction to that. I had a feeling that you might want to comment on that too.
I just wanted to say something that the most influential stakeholder in health policy today is in tobacco, alcohol and food industry. Just it was the reason why I reacted.
Okay, good. Good. Stakeholders, you take on board.
Yes. First of all, I completely agree about what the Estonian colleague mentioned about this multi-sectoral approach. Certainly, one sector cannot do anything with just all sectors together, and the other approach could be that a couple of days ago we had conference on pregnancy and nutrition during pregnancy, and there was also about which are the stakeholders who have to take responsibility. Certainly, again, many sectors, and I did like such a division that one important stakeholder certainly is policymaker, the other one is health professional, certainly, then civil society, where certainly again NGOs and different other, but also we have to remember about researchers, that they have a role in this game and to provide us evidence what is good and what is not good, and to support policymakers, civil society and professionals in this game. And also I would also, as being maybe a researcher, to stress the role of researchers also in this game.
I think in this environment, this is a great last input here. I don't want to prolong this too much because we're 3 minutes or 4 minutes over schedule. I don't see any questions from the audience, which means that you actually had a very interesting discussion at the panel. Thank you very much for that. Thank you for staying with us. I'm not sure if you're going to make a last announcement now as the master of the ceremony. Thank you very much for this discussion.
Thank you. Last but not least, we are very thankful to organizers coming from different countries. Tallinn University, Vytautas Magnus Kaunas University and Population Europe, your supportive staff. Without your support it would be difficult to organize such an event, but actually I'm sure that that's not end of our collaborative efforts, that we will continue, and I'm looking to our French colleagues probably. So there is some perspective to see not only such nice presentations, but also something putting together on paper, like a book on Russian Federation or Ukraine, very interesting book. So just continue, and result will be good. Thank you for your participation.